We've seen in other countries, Omicron spreads very, very rapidly. In Hong Kong, we have a lot of measures to slow down transmission, and I think they're working, but they're not stopping it. I would say it's likely that within the next 2 to 3 months, most people in Hong Kong would have a chance to get infected. If they're immune because they've already been infected, maybe because they've been vaccinated, particularly with BioNTech. Don't think it's feasible now to contain the virus in the sense of getting back to zero in the short term. I think at the moment, case numbers are going to continue to increase for maybe another month, and there's going to be this exponential increase for at least 2 or 3 more weeks. And so that means we have to think about changing away from the current strategies, for example, to isolate every case, because very soon we won't have capacity to do that. For me, the priority right now is actually to vaccinate older adults, because the vaccine uptake is not that high, particularly in the eldest. And we know that the vaccination can make a massive difference if older people do get infected. If they're vaccinated, the prognosis is much, much better. Well, that's more talking about the long-term strategy, where I think it's not that anybody wants to live with the virus and wants it to infect lots of people. But I think the issue with something like Omicron is that it's very difficult to stop it. And so the best you can do is think about ways to slow it down, and also to have a high vaccine coverage so that the health impact is as low as possible. I would say in the next 3 months, we have to do as much as we can to slow down the spread of infection, to vaccinate as many older people as possible, because that's going to make a difference in terms of the impact of this current wave. And for the longer term strategy, I think that's another discussion.